Dr. Madden, I want to go to you. So talk to about usage and the forms of it, because there have been lots of questions about smoking. In fact, Bruce Kleinschmidt from Jefferson County says, I have no idea if marijuana has any medicinal properties. However, I can say that it's extraordinarily difficult for me to breathe around marijuana smoke. In the event it's ever legalized, can the usage be restricted to perhaps only the patient's private home?
I would have to let Representative Nemeth speak more to the specifics of the bill, but I imagine that there would be specifics with respect to how and when and where it can be used. Obviously, we don't want people driving up and down I-75 intoxicated. However, folks that are being managed with other potentially sedating medications, if they are not intoxicated, they can use those things and still effectively work or drive. With respect to the different forms, again, we've mentioned different tinctures, edibles, vaporization devices. So yes, I think there's a multitude of different methods of delivery. And with respect to concentrations and things of that nature, again, with the ability to actually advise a patient and work with a patient, you can start slow and work your way up gradually. And there are studies that suggest that low dose treatment with cannabinoid-based medicines, so including the THCs and the CBDs, that low dose is just as effective as even medium dose, and memory issues don't come until you get to high dose type treatments. So again, I think there is a way, if we loosened restrictions and allowed physicians to work with patients. It's not allowing them to self-medicate. Heck, they're already doing that. They're doing it with a multitude of different cocktails, and in fact, very few primary care patients that I have are on fewer than 5 medications, and I think if you ask most pharmacists, anytime you get to 5 medications or more, there are going to be drug interactions, and even with the computer programs these days, it's hard to predict the nature of those interactions.